A century ago, a small cut to your body, a tooth infection, or a simple chest infection could lead to sepsis and death. Thankfully, today, because of antibiotics, it doesn't occur. But there is something dangerous which is occurring, which we need to talk about, which is antibiotic resistance. My name is Dr. Sandeep Singh, and today we are going to talk about this terrifying prospect of having an antibiotic which does not work, antibiotic resistance. So friends, antibiotics were one of the greatest miracles of modern medicine. But as we evolve in medicine, similarly the organism, the bugs which cause this infection are also evolving. They are learning and we are greatly losing this fight. Now we need to understand that this is not a hypothetical situation. Antibiotic resistance is responsible for millions and millions of deaths every year. Now this is scary because sometimes the burden of these deaths is more than HIV or malaria. So the more we are fighting communicable diseases, but we are losing on this front. Now me being an orthopedic surgeon, this is very personal for me because we have loads and loads of patients who come up to us with periprostatic infections, other infections, bone infections, which should just be treated with some antibiotics. Unfortunately, more and more in our clinical practice, we see infections which are resistant to antibiotics, and we need to go back to antibiotics which are toxic or can cause damage to the body, or some antibiotics which were obsolete. Now, why does this happen? This happens because of a term called as multi-drug resistance. Now friends, multi-drug resistant infections are infections which have the capacity to fight all kind of antibiotics. Now, what are we left with then? When we have antibiotics which do not work, which do not kill the bug which is causing infections, we have to unfortunately nuke those bugs with very strong medicines which can potentially cause side effects to the liver, kidney and to the general health of the patient. Now simple infections which are very common in a post-operative period like pneumonia, urine infections are getting harder and harder to treat. If all antibiotics fail, then there's nothing left, so even after multiple surgeries, multiple antibiotics, the patient might just never get okay, and this can become very life-threatening. Now we get back to the reason why is this happening. I'll tell you 3 things: overuse, misuse and unregulated sales. Now you have seen in your clinical practice as doctors and as general population also that people take antibiotics for simple things. For a general cough and cold which is viral, we take antibiotics, we take it for few days, we don't complete the course. This is called self-medication, now which is very, very dangerous. We need to understand that when we self-medicate and we do not complete our courses, we are actually causing superbugs to grow. Now we need to understand that if we do not change something about it, we are in a scary place. We could see 10 million deaths per year by 2050 due to antibiotic resistant infections. Imagine the burden. That is 1 person every 3 seconds just because of antibiotics not working. I am not talking about natural causes. This is just because of healthcare failures. Now, I don't think this is just a healthcare failure. It is about all the people involved in healthcare and as general population, the people also. Patients should not self-medicate. Doctors should not give antibiotics unnecessarily, and we need to understand that they are a very limited source. Antibiotics is a resource which we need to control and to protect to save mankind. If we rampantly continue using antibiotics like we are looking at a very dark future. So I'll give you the solution to this. What do we do to stop this, and how do we prevent ourselves from getting doomed because of no antibiotics? Number 1, never take antibiotics before a prescription. You should not self-medicate. Number 2, whenever you have started antibiotics, even if you feel better, complete the full course. Do not give the bacteria a chance to linger on and continue. Third, don't pressurize your doctors to give antibiotics. And doctors never fall in this pressure and just don't give antibiotics just in case. We need to give antibiotics when there is a clear clinical indication to give antibiotics. Friends, antibiotic resistance is a war, one that's already begun. If we do not act now, routine surgeries could become life-threatening. Infections which were normally controlled would never be controlled. And the miracle of modern medicine, where we have successfully increased our longevity, our quality of life, could be undone. Through this video, the message I want to give is let's protect our future and let's protect antibiotics. It is pivotal for our survival. Thank you.